Coronavirus: all you need to know about its symptoms and risk. There is a spread of a novel coronavirus which is wreaking havoc on the city of Wuhan located in the Hubei province of China. The outbreak of the virus began early in December of 2019 and has continued to spread. The people who were the first ones to become infected were all linked to the South China seafood wholesale market, which has been closed ever since. Thousands of cases have been reported by health officials in China. Some cases have been identified in other countries, mostly spread by the people traveling out of China, including Chinese people or the people returning from China to their respective countries. The virus can spread from one person to another through contact or even just being in the proximity of the infected person. Over 20 countries have reported cases, including Singapore, Japan, Hong Kong, Thailand, Malaysia, South Korea, Taiwan, Germany, Vietnam, Australia, France, Italy, the United States, India, the UK, etc., and many other countries have set up screening centers for the people coming from China. This is a large family of viruses that are collectively known as the coronavirus. Most of the non-coronavirus symptoms only have simple effects on the people, such as giving them a mild respiratory disease like the common cold, but there have been 2 such cases of the coronavirus that has shown massive effects on the infected, which are severe acute respiratory syndrome, SARS coronavirus, and Middle East respiratory syndrome, MERS coronavirus. Symptoms: fever, coughing, and difficulty breathing are some of the signs and symptoms which have been observed in the people infected. Some of the patients have also reported having a sore throat. There's been some speculation about the severe disease-causing potential of the novel coronavirus, although these claims are not supported with proper proof. People with chronic illnesses and aged patients might pose greater chances of having a severe disease as a result of this virus. And Italy to the country now with the virus, and an Italian man bought a plane from Milan to Nigeria. That was how the virus got to Nigeria, and an Italian man also took the virus to Lithuania. Risk: the people who are living or traveling around the area where the virus is prevalent are at a high risk of infection according to the WHO. Currently, the virus is in China and other infected countries, and all of the non-residents of China who have been infected have traveled to China recently and have been in contact with the infected people who are from China. So, according to WHO, the risk to the people living in China and other infected countries are very low, as you don't come into contact with one of the non-resident Chinese people who are infected. Also, the WHO states that simple disinfectants can easily dispose of the virus if it is present on a surface, and also the survival time of the virus on any surface is pretty low. Conclusion: the article shares all of the symptoms to look out for if you think that you might be affected by the virus, but if you're a non-resident and have not been in contact with any of the infected countries, you have no chance of catching the virus. To know more about what coronavirus is, its symptoms, risk factors, how it spreads, prevention and treatment. There is currently no vaccine to prevent coronavirus disease in 2019, COVID-19. The best way to prevent illness is to avoid being exposed to this virus. However, as a reminder, the CDC always recommends everyday preventive actions to help prevent the spread of respiratory diseases, including: avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze with a tissue, throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Follow CDC's recommendations for using a face mask. CDC does not recommend that people who are well wearing a face mask to protect themselves from respiratory diseases, including COVID-19. Face masks should be used by people who show symptoms of COVID-19 to help prevent the spread of the disease to others. The use of face masks is also crucial for health workers and people who are taking care of someone in close settings, at home or in a health care facility. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty.